Hello, 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 and welcome back to the Train Smart, Run Strong podcast. Today, I have an awesome guest with me, and he is actually a longtime friend as well. I have Josh Weber. He's a physical therapist. He works at Pelvis NYC, which is the go to center for male pelvic floor therapy in New York City. And this is like the perfect episode to go back to back with the episode that I had dropped last week. Josh, thank you so much for joining me. How are you doing today? What's going
Thank
on?
thank you so much for having me. And I love that we're piggybacking off of like a women's pelvic floor therapy. I think that's so awesome to do a back to back. So the timing is just perfect. And I'm so
The
happy.
timing is perfect. The timing is perfect. And I'm so happy because like a couple different topics we spoke about last week, I feel like is going to be even more so this week. We said so many times, like, women just aren't talking about pelvic floor health issues. And I think even more so
If you
with
think women
men.
are talking about it, if you think it's bad,
Yeah,
like you have no idea how bad it is for guys. Um,
exactly. Exactly.
the lack of talking is just it's really a detriment. So I would love
Yeah.
to spread more information, education, and awareness for it. So let's do it.
That's why we're here. And yeah, I think that's also what is really cool about what you do and Pelvis NYC because like it's not talked about. I personally had never seen any like specific clinics for male pelvic floor health before you told me about it. So I'm just really excited to dive in. But I want to kind of start first, like I kind of mentioned this already, but Josh and I go way back. We worked together at my first job. Josh, was it your first job at Motion
It
PT?
was my first job as well. It was my
Yeah,
first. I was a little baby physical therapist. Uh,
yeah, which is
which,
crazy to say.
yeah, it was a wild time. I felt like I knew nothing when I started there, and you kind of knew a lot of things, and so did a lot of other people. And now here we are doing a podcast together, and that's mind blowing to me.
Yeah, yeah, I know it's crazy because what year was it that you started? Like
I started in
2017?
2017.
Yeah.
2017,
So like
2018. Yeah.
I didn't know that much more than you. Like I had been there a year maybe.
Yeah, and the thing that I've now come to realize is that nobody really knows what they're doing when we first start out, and it's just like you learn it. You have great. We happen to have had great, peers to learn from, and super awesome people that we worked with. But you kind of learn it as you go, and the more people that you work with, and the more people that you see and connect with, like the better you get at your job. Um,
Yeah.
this job being helping people and getting them back to their lives, which is really cool.
Yeah, and that's really a testament to the people that we were around and just like the vibe that we had. I feel like all of us were not just like PTs in the same clinic, but we were actually all like friends.
Yeah,
And I
yeah.
think that was really helpful for just creating a situation where we could all learn and where we
We,
could all like
yeah.
improve. What'd you
Yeah,
say?
it was the amount of knowledge in that space for that time was just like something that I had never experienced before, and to be able to just like soak all of that in was super super helpful, and especially for starting out, like there are things that I find myself saying that I remember hearing you or other people in the clinic like just repeating. I'm like, oh my god, that just takes me back right to that gym, and
I
yeah.
feel the same. I feel the same. And yeah, and that's like really your formative years as a PT. So I think that's so important. But I don't know about you, I kind of, and I've shared this before on my podcast and other podcasts before, I also hit a point where almost kind of felt burnt out a little bit too from PT. Like a clinic like that where you see so many people and so many different types of issues,
Yeah,
I
yeah.
think it can be a little bit easy. So I'm kind of not surprised that like both of us have specialized a little bit more than just like orthopedics.
It took me a minute to figure that out and to get to where I needed to go. Um, but I'm so happy that I figured out that this is the niche that I wanted to lean into and to help the most.
Yeah. Can you tell us more about that? Like, how was that kind of flow? And because I know that you worked somewhere else before,
Yeah,
after motion and before
yeah.
pelvis. So, yeah.
I I unlike you, I stayed in the orthopedic world a bunch more years. worked through COVID, did all of that. That was a lot of fun. That was really interesting.
I'm
Uh,
sure. So different.
um, and then at some point, I just found myself getting, like you said, burnt out. It was a lot of different diagnoses, a lot of different people. I was seeing a lot. Um, and I was helping people, and it was great, and it was a lot of fun. But I was just like, I feel like my passion is not there. And I've always kind of like said that I'm not really a gym rat. Like ortho was not super my thing so much. Like sports was kind of a little bit. I ski, and that was kind of actually I just ski. That's the only sports. And then so I was just like, I need to
Good
figure
sport.
out. Yeah, that's my sports. I need to figure out where my passion lies, and so I did a lot of internal, searching. And as a queer therapist and as a gay man, I wanted to be able to bring that part of me into my career and into my job. And so when I was thinking about it and thinking about how to do that and how best to incorporate these different aspects of who I am into my job, I knew that pelvic floor was, a thing. And I knew that it was mostly for women, but I knew that there were some guys that dealt with pelvic floor issues. I wasn't really 100% sure what it was, but I felt like there could be something there. And so I started doing some research, and I was looking at male pelvic floor clinics, and I was wondering how many in New York City, how many male physical therapists treating male patients there are in New York City. And when I started researching, I saw that there were like 4, maybe 5.
I would have guessed 0. Like I literally would have guessed 0.
I mean, I don't know what I don't know what I was expecting to find. The number that I found being as low as it was is like mind blowing to me, given how many people live in the city, and uh, the amount of people that could possibly use this help. So
Yeah.
I kept doing research. Um, this place, Pelvis NYC, kept popping up. So I reached out to the owner, Dr. Adam. He's also a physical therapist.
Shout out.
Shout out Dr. Adam. He's great. And so I reached out to him on LinkedIn, and my initial, questions were like, how do I get into this? What do I do? Like, I don't know about you, but when I was in PT school, we did within the 3 years of schooling, we had a single day of pelvic floor, like one day out of 3 years. We spent 6 months on hot packs and ice packs, but it was one day of pelvic floor. So
So I think I told you at NYU we had like a full course on pelvic floor, and we actually had like medical what they call models
yeah,
from the medical school come in so we could do the internal examinations, but it was only on women. And I swear the like male pelvic floor health that we received, I swear to you, I mean I could be wrong, and some of my classmates forgive
yeah,
me if I'm messing this up, but I swear it was like one sheet of paper that was like, oh yeah, and like potential issues for men are
that's
this, and it's like,
but
yeah,
that's
it's kind of
given,
crazy.
given what's out there. So yeah, we did one day. We did one day, and we didn't have models or anything. So I had no idea. So I was just like, I want to get into this. I think that this is what I want to do. How do I go about it? And so took a couple of courses, read a bunch of textbooks, got some training in, started seeing patients, and we opened up this clinic, this beautiful new space in November of
Stunning.
it's
Stunning, by
it's
the way. I've seen it.
it's
Yeah.
it's really amazing. And we wanted to create a space that was safe and comfortable, for men to come in, for all people to come in, but specifically men to come in and feel like they can be heard and understood, which is something that in this area they are not typically listened to for that long. Um, so yeah, so we opened this up in November of 2024, and it's popping off now. It's popping off.
Hell yeah. That's what I'm
Yeah,
talking
and
about.
for me, like as somebody who is not really super sure about what they wanted to do, like when I figured out that male pelvic floor therapy was a thing and this is what like I could do, I was just like, I've never been more sure of anything in my life. And that's just I knew immediately. I
Ugh.
was like, this is it. This is it. And I feel like you have the similar, story with the run club, with the run coaching. Like,
Yeah.
once you figure it out, like it just clicks.
Yeah, that's exactly how to describe it. And that's why like I'm literally just like nodding my head and like smiling so big because I know what that feeling is like to find something like, oh wait, like this feels like my purpose. Like this
Yeah.
is why I put in all of those hours in undergrad, in PT
Yeah.
school, working first job. Like
Mhm.
that's what it was for.
Yeah. Yeah. Interning
Yeah.
for free and working in hospitals and
Oh,
working in
yeah.
different settings and like not getting paid and, the crazy hours and board studying. Like, it never made sense to me until I started this. Now I'm like,
That's
oh,
awesome.
that's why. This is
That's
why.
awesome.
Yeah.
I love it. So let's get into kind of just like, especially for the audience, right? Because my audience is mainly runners, probably mainly women, though I think we do have some men who listen, and especially the men
And
that will
those
see
women
this. Yeah.
and
Yeah.
those
And honestly, like,
fathers and brothers and
that's
sons and
exactly what I was going to say.
uncles and cousins and
Yep.
anyone.
Yep.
And
If you're a woman listening to this episode, like this is also really good information because it just simply needs to be talked about more.
yep,
And if you can talk about
and
this with
normalized and
and
normalized.
normalize it,
Yeah.
exactly, and normalize it, and speak about this with the men in your family, your friends, all of that stuff. Like that is step one in
Hmm.
making sure that everyone gets the care that they need. So let's kind of go into just like maybe some I don't there's so many directions I can take this in. So I kind of want to start broad
Okay.
and maybe not even like running specific, but
Hmm.
let's just start broad. What are some like common diagnoses that you see, you treat, and maybe some of the symptoms that go along with it, and then we can get more like running specific.
So I would say like the most common diagnoses, and we're gonna use that word very loosely,
Yeah.
but because a lot of the guys that come in here don't even get that far. They don't even get an official diagnosis. But the
Yeah.
most common one would probably be chronic prostatitis,
Okay.
um, either bacterial or non-bacterial. Most times non-bacterial. That's going to be the most common one.
Can you just describe it for people? Because I feel like the majority of people are not in medicine who are
So,
listening to this.
yeah, of course. So, chronic prostatitis just means that your prostate is inflamed in some capacity, and that's going to cause a myriad of different of symptoms, whether that's urinary frequency, urgency, incomplete emptying of your bladder. It can lead to burning in the tip of your penis. It can be waking up in the middle of the night to run to the bathroom. Once I've heard, once to three or four, sometimes even five times a night. Um,
Is one time a night not normal?
no, one time a night is definitely not normal, but I've
Oh,
heard it.
shit.
I've heard it even. I mean, if that's your thing, then like sure, if that doesn't bother you. But I've heard it like four or five times a night, which is,
Wow.
how do you sleep at that point?
Right.
How do you get rest, right?
You
If you're
don't.
constantly, you can't recover that way.
Mhm.
So that's a big thing. Testicular pain, burning, heaviness, tightness, pulling. Um, then we have issues of erectile dysfunction in whatever capacity that might be. So issues getting or maintaining an erection. Premature ejaculation, and then somewhat new diagnosis that's been coming around is called hard flaccid,
Hmm.
which is a syndrome where even at rest, you're not like fully. Your penis kind of feels like tubey and rubbery,
Hmm.
and you kind of lose
Like it's not relaxed.
It's not relaxed. It's kind of getting retracted, pulled back, and then
Oh,
when you get an erection, it can be like 70 to 80% of full erection and not get all the way to 100%. So
interesting.
those are, yeah. And with that 70 to 80%, like penetration is a lot harder to achieve. Specifically, if we're talking anal sex, that's a big deal. Um,
Yeah.
and then yeah, I mean the other big thing is that we see over here is post prostate cancer. So radical prostatectomies. That's a big deal.
Ooh.
So that's the entire other side of things, which is more of the incontinence side. and getting guys out of after surgery, out of wearing Depends and back into regular underwear, and being able to comfortably go throughout the world and not have to feel like they're constantly leaking. Um,
Yeah.
and the
Yeah.
crazy thing is that a lot of times after prostatectomies, they're given the Depends and they're told to wear diapers, and they're not told to go for physical therapy. And so these guys are just walking around in Depends, thinking that this is what their life has to be like. And they'll go through a couple of pads a day. And nobody told them that they can get stronger and they can get better if they sought out treatment. So it covers
That's
the amount of things that this covers is it's crazy. It's
and
crazy.
the parallels to the episode from last week are like insane. A lot of women
Sure.
aren't told. Yeah. I just can't believe that it's such a like forgotten about body part. It's almost like it has been shunned, like we can't
It's
discuss things as if they're normal.
it's shunned, it's stigmatized, it's
Yes.
anything that has to do with this area of our body is considered dirty or
Right.
unclean, or just we don't talk about that. And we would never say that about, a shoulder injury. And it's just another part of our body. And yes, obviously it's a lot more intimate, that's for sure, but it's just another part of our body. And when something goes wrong, we shouldn't be ignoring it. We should want to fix it, right? We should try and fix it. We owe it to
Yeah.
our patients to do that.
Yeah. That's
Yeah.
such a good point. What are some what are some of like the kind of alongside the stigma with all of this, what are the hesitations of some men for even like seeking help that maybe they've shared with you? Maybe like after seeing you, they're like, oh, I was so scared to come in. What are some of those things that you've seen?
There's just so much shame attached to it. There's so much shame and embarrassment. And if you think about it, um, there's a lot of pride in this area in guys. And when
Right.
we think that these areas aren't working, and if you hold this to be like what what makes you macho or manly, and now all of a sudden it's not working, oh my god, who am I, what am I doing? um and then to seek
Can I
treatment,
ask
which
a question? I don't mean to cut you off.
of course
Do you see a lot of men who maybe initially would seek like more medicinal or like pharmaceutical treatment? Because I feel like I don't know if this is something that goes along with your treatment, but like I feel like Viagra has become such a commonplace
So yeah,
thing.
so most of the guys that we see that are coming from like a urology, like from the medical pipeline, right, that have
Uh-huh.
been through to see urologists or colorectal surgeons, um, or neurologists, they've been on. Most of them are taking Viagra or Cialis usually daily. Some of them I've been told to take Viagra when needed to try and help with that. But most of them, 5 milligrams of Cialis is what we're pretty much seeing. Um, but they've also been on a bunch of different medications before coming to us. So they've gone through the medications route, and it's worked a little bit, right? You start taking a new medication, something's going to change because you have this new, chemical in your body, so it's going to affect something, but it's eventually it's going to stop, and
It's
your
like a
body's going to,
band-aid.
yeah, it's like a band-aid. It's not healing the actual problem.
Mhm.
And the frustrating thing is that all of the tests that are run and the diagnostics and the imaging, um, it's all coming back negative, right? So they're going and they're getting treated and they're taking this medication, but it's like, what are we taking the medication for if you can't find out what's wrong with me, right? So
Wow.
at that point, they're kind of done taking medications, which
By the time they see you.
by the time they see me, they're like, I don't
So,
want to take a pill.
yeah, do you feel like if I'm sure there's room for this to like have a referral to physical therapy alongside, initial pharmaceutical um uh options, but is your goal for most men to like eventually completely stop as
Oh,
well? Like maybe okay.
for
Yeah,
sure, for sure.
good.
Like most of the guys that come in here have stopped any antibiotics that they're on.
Mm,
And again, when I say that, they don't want to take another pill, if you have tested positive for anything, right, obviously take the medication, take the antibiotics that are prescribed if you
Right.
need it, right? But if nothing's coming back positive, like, why are we taking another one? So
Yeah.
at that point, they're not taking medication that when they come through the door. Maybe
Wow.
still the Cialis daily if they want to.
Wow.
Um, yeah, yeah.
That's very cool. How do you feel like people have found you? Because if I mean, I'm sure doctors are starting to be a little bit better
They're
about
starting
referring out.
They're starting
Yeah.
to, and they're starting to get better at it, and we're really making a push to try and get them to really understand what it is that we do and how we can help them and their patients, right?
Mhm.
Um, the ones that don't get told about physical therapy or pelvic floor physical therapy, I should say, at a certain point when they've gone to see as many doctors as they have and they're still not getting better, they're going to start Googling. They're going to start going on Reddit. They're going to go start going on ChatGPT, and that's where we come into the picture. Is
Good.
it comes up pretty quickly over there. So
Good.
it's been really beneficial to us. I would love it if more doctors would talk to their patients about it. But if this is the way that it's going to be right now, like, that's just what it is, and it does get them here, so that's important.
Yeah. Then we're gonna do the podcasts. We're gonna do all the
Mhm.
social media stuff as
Why
much as
that's
we
why
can
we're
get it
out here.
out there. Yeah. Okay. Something interesting that you said there that I want you to go into a little bit more, make the distinction of between just like regular physical therapy and what you do.
Yeah,
Because that like what we did back in our days working together, that's not gonna be enough for the population that you're seeing. So
correct.
can you go into like what a typical session looks like? I still want to get into like the diagnoses
Yeah.
too. I know that we already talked about what the common ones are, but like what's a typical session like and why does it differ from
So
regular PT?
the way that the philosophy that we have here is we try and create a space where men feel safe and taken care of. And what we have found is that the most effective way of treating a lot of these symptoms um, is hands-on manual therapy. So not super different from what we've been doing, but it's really a focused, targeted, hands-on direct massage manual therapy, myofascial release, what have you. Now, is it in an area that we typically didn't usually go to? 1,000%. We have to work through a lot of these muscles that are super important in maintaining, the function and the integrity of your pelvic floor. So if that means we got to work through the lower abdominal muscles, we've got to work through your adductors, we've got to work through the perineum, which is the fancy term for your gooch or your taint, what have you. Um, and then there's an aspect of internal work as well. We have to get to the deeper layer of the pelvic floor muscles in order to really help these guys because and there's no other way to get there other than rectally. So
Yeah. So what would you say to someone listening to this who's like maybe it's a guy who's experiencing some of these issues and they're like, I just don't feel comfortable with someone
going
doing that.
Yeah,
Yeah.
I mean, what I always tell my patients is that, especially on the first session, like, if you are not mentally prepared for that, if that is not something that you are 100% comfortable with, I totally understand, and we can 1,000%, we can work around it for sure. I would urge you to, try and do some research and see what the benefits are, and make that decision for yourself. I would prefer to not try and convince you, right, for something so intimate that I need you to come to that conclusion on your own. But it's really beneficial. It's really helpful. It makes a difference, honestly. And it's not as scary as you think. It's not as
Literally just
uncommon.
another body part.
It's just another body part, and we do everything in our power to make it comfortable, as possible for you. And just because a patient says yes on their first session, like, doesn't mean we're going all the way in, right? I only do what your body is going to allow me to do, right? And you're the one that's completely in control. So if it's too much, we stop right there, and that's totally fine.
Cool. Yeah.
Yeah.
I also think that it's kind of one of those things where like this is a doctor's appointment. Like this
Yeah.
is a medical like procedure.
Mhm.
Not procedure is
Mhm.
not the right word, but like this is for
It's
medicine.
it's a treatment.
It's treatment.
This is
Yeah,
and what I also tell them is like, can what we are about to do be that much worse than how you have been feeling?
exactly.
Right?
Yes.
How much worse could this be? Um,
Right.
and it's really the thing that works in our favor is that a lot of times it can't be much worse because
Right.
they've been suffering for months to years. I've had patients tell me that they've been dealing with this for 5, 10, 15 years almost. So at
Yeah.
that point, if I can if I can tell you that we're going to do something different and it's going to be beneficial, like most people are open to it because they need something.
Yeah. Yeah, that makes a lot of sense.
Yeah.
Um, so okay, so you do the manual therapy as
Hmm.
much as necessary and what people are comfortable with,
Yeah.
and
Yeah.
then how
And
does
then
the yeah,
we what we do over here, because a lot of what we see with men, which is what I think is going to kind of differ from your previous podcast, is that whereas women deal a lot with pelvic floor weakness, which leads to more incontinence, guys tend to deal with more hyperactive and hypertoned pelvic floors, which lead to frequency issues, and erectile dysfunction. um, so what we do is we try and get them to relax. So we coach them on breathing. We coach them on stretching. Um, the effects that diaphragmatic breathing have on your pelvic floor are like crazy.
that's
And just
awesome.
being able to, these guys have been in their sympathetic, fight or flight mode for God only knows how long. They can't get out of it. So
Yeah.
the more we can teach them to engage their parasympathetic system and get into that rest and digest system, it's going to allow you to relax. And once you start to relax, the pain is going to start to go away.
Yeah.
So it's really a function of getting these guys to relax and breathe. And especially when the patients are type A, high strung, working in finance,
New York City.
Wall Street type, like, there was just a Bloomberg
Yeah.
article that came out that we were featured in, which is really cool. Um,
Shout out.
came out, shout out to Bloomberg for that
Yeah.
article. Um, and it's a lot of the pelvic floor world is skewing younger, right? It's no longer just the 65 and older, which is what we historically have associated. Now it's guys in their 20s and 40s, 20s to 40s that are really suffering and are really, in need of attention. And they're high stress jobs and they're sitting for hours at a time at their terminals. They can't move, they can't get up. They're being yelled at by their CEOs. Like, it's stressful, and stress manifests.
Yeah, it's probably a combination of yes, high stress positions and especially those going to younger and younger people. But also,
Yep.
do you feel like there is more awareness in general about these types of things, even
I
though it
think
has been so stigmatized?
I think it's starting to come about. I think
Yeah,
there's a lot of good information out there, but you have to like dig for it. But it's starting
right.
to come more and more to the surface. I think a lot of guys are taking to Reddit and
Yeah.
some Facebook forums, and honestly, ChatGPT, like AI, is
That's
becoming
the future. The future.
it's
Yeah.
becoming a huge way to type in your
Get
symptoms
answers.
and get answers, and like
Yeah.
better than some of the answers that have historically popped up previously, like
Yeah.
actual,
Yeah.
like, this is what might be happening and maybe these are the professionals that you should seek. Because a
Yeah.
lot of
Good.
times a lot of times these guys, once they start getting these their symptoms, they start small enough, right?
Yeah.
It starts to grow and grow,
Mhm.
but they don't know where to even go once they realize that they need to see someone, right?
Yeah.
They don't even
Yeah.
know that maybe they should see a urologist. Maybe they should
Right.
go to a colorectal doc or surgeon. And so AI is becoming really beneficial in telling them where they need to go, or pointing them in the right direction. Honestly, that's really what
Yeah.
needs to happen.
Yeah. Well, good. I'm happy to hear that it's moving towards that. So let's go a little bit more specific
Okay.
and more into like maybe some of the signs and symptoms that some of the runners should look out for, or like some common diagnoses that you would see in a male runner, that you would see in your clinic.
Yeah. So running, can put a lot of stress and pressure on the pelvic floor. So certain things that we want runners to look out for, or signs of pelvic floor dysfunction, are going to be, penile pain is definitely one of them. Testicular
Mm.
pain, um, incontinence while they're running, so like leaking while they're running. You can have post-run pain. It can lead to a new onset of some form of erectile dysfunction. It can lead to um, post orgasm pain after runs, which is
Mm.
interesting. Uh huh.
Interesting.
Yep. Yep. Stress incontinence, urge incontinence, all of those are pretty common symptoms. Things like pudendal neuralgia can become apparent. So kind of like burning, tingling, coldness in certain areas. Um, based on the pressures that are put throughout the body when we run. So those are the pretty common, you know, diagnoses or symptoms
So
that we see.
for someone who's listening to this and they might be thinking like, "Oh, it's not normal if I like leak a little bit while I'm running." Like, is that not normal? What would you say to them?
I would say it's a little bit is okay. It's not
Mhm.
great. Obviously, we shouldn't be leaking, right? The goal is for the muscles to be strong enough to prevent incontinence.
Yeah.
It's really it depends on what you're okay with, honestly. And if you're okay with it and it's just a little bit, like, and you want to try and do some stuff on your own, yes, that's fine. But if it becomes a problem, and if it starts to get more and more, and you start noticing that things change with harder runs, or more uphill, or more strenuous runs, or longer distance, like that's when we need to start seeking help.
So if someone was at the beginning of this and is kind of like, I'm like a little bit uncomfortable. I want to see if I can try and do some things on my own. What would you recommend for them?
So, especially with like the with the leaking part,
Mhm.
I would always advise patients, like, I'm not one to stop them from running. I know how that goes. I
We love
know
hearing that here.
I know how that goes. I know it's not going to happen. So be more mindful when you're running, right? Try and focus on your breathing while running. Runners tend to take a little bit more shallow breaths, and then they tend to clench their abs a lot more, especially if we're going uphill. That tends to put a lot more, create a lot more intra-abdominal pressure, which causes a lot more stress on the pelvic floor and doesn't allow it to relax. So,
Mm.
what I would tell uh, any kind of runners, male, female, anyone, breathe. Just breathe. Make
So
sure
that's
you're
so
breathing.
important.
Mhm.
That's like something that
So
we
you
don't
have
talk about.
forget to breathe, and don't breathe properly, right? You need to take deeper breaths, get that breath all the way down in there.
Yeah.
um, that's one way to go about it. I don't necessarily think that the immediate answer is Kegels. Maybe at some point, if we're dealing with a real weakness, but most times it's not weakness. Most times it's hyperactive, and we need to
Yeah.
calm down. So
Yeah.
breathing is the way to go, honestly.
Yeah, this whole idea that like and I've there was a time in my PT career where it was like, "Oh, it's weak, strengthen it. It's weak, strengthen it. It's weak."
Yep.
Like I wish it was that simple for everything. And like don't get me wrong, in the running world, sometimes that actually is because
Yeah.
running is a high demand. But I think specifically when it comes to pelvic floor, and at least what I learned about, namely it was about women, but still similarly, like a lot of the stuff that I learned, you can tell me if you guys do something similar. It was like a lot of biofeedback type of
There's
stuff.
a there's a lot of biofeedback. Yeah, yeah.
Yeah.
Because when you think about it, right, we do have some control over these muscles, but it's not
Mm,
muscles that we tend to use or voluntarily use in our
right. Or
day.
even know that we're using them
Yeah,
because we're not focused on
exactly,
it.
exactly.
Yeah.
So the more that we can do some biofeedback to get you to understand what these muscles do and where they are and how they work. And there's so many different ways to do biofeedback. We can do it manually. We can do it instrument assisted. Like there's so many different ways to do it. Yeah, and they're starting to do um, games with biofeedback, which
Ooh, tell me
uh-huh.
more.
There's new tech that's coming out that involves um, it's essentially using the muscles to play a game, and you insert
We
a
love
probe.
that.
You insert a probe, and you have to contract in order to move. A skier down a hill or like a plane through the clouds on an iPad that's in front of you, um, and
Cool.
it, and it will only move if you use the right muscles. And so, the development of technology is really going to be helpful in getting people to understand their bodies and to know their muscles and to help them, retrain.
It sounds like you're also excited about that.
Oh
I
my God,
think
it's
there
so
would
much
be
fun.
some people
That would be
who would
so
be like, "It's gonna take my job," but
no,
I don't
no.
feel that. I mean, I haven't felt that yet
Yeah,
with like run
the
coaching.
only thing that I have felt is that it's going to help enhance my job, and
That's
it's going to
exactly
help
how
me
I
do
feel.
my job. It's going to help me do
Yeah,
better. You know?
I love that. I love that outlook. That's awesome. Cool. So, is there ever a case where you would say like, "Okay, time to get stronger," and like maybe what are some probably like initial exercises
Yeah,
that
I
you would
mean,
give?
there's always a case to get stronger, right?
Yeah.
And it's not maybe we're not strengthening the pelvic floor per se, but right,
Mhm.
we need a good core, right?
Yeah.
The pelvic floor needs support, so we need good core
Yeah.
strength, we need good glute strength, we need lumbar stability. Um, right, what is running if not repetitive impact and the distribution of forces throughout our body, right? And a lot of those
Yeah.
forces get distributed through our hips and our pelvis, so all
Yep.
of that needs to be strong to help support it. So, good exercises that we like to start with, pretty common. Glute bridges are always good.
One of my
Planks,
faves.
glute
Mm.
bridges, when done properly, can be so effective. A
Yeah.
lot of times they're not done properly, but they
Yeah.
can be done super properly,
Yeah.
and they're very effective.
Yeah.
Planks both forward and side, right? those are
Love
those
it.
are really good.
Perfect.
We'll do some lunges with them as well,
Mm.
and we'll kind of go through some um, phases of running, right, and where they feel like they are
Oh,
breaking
I love
down,
that.
and then
Yeah.
train in that specific area. So if your issue is uphill and you find that you're straining more and you're getting more leakage or you're getting more pain when you're uphill running specifically, we got to train other muscles. And we have to work through a lot more, glute strengthening, a little bit higher functioning. A lot of stability work needs to happen, right? If you're running through the streets of Manhattan and you're going down through like Tribeca and there's cobblestone, right? You need to have a stable base of support.
I love
Um,
it. I love it.
so we try and make it right. So it's when I say that there's not strengthening that needs to be had, that's more for the pelvic floor, but strengthening needs to be done elsewhere to support your
Yeah.
pelvic floor.
If someone wanted to come see you guys for prevention, is that
Yeah.
an option?
It's definitely an option. It's definitely
Mhm.
something that's doable. And again, like I
Mhm.
said, if you, I would urge everyone who's listening to this, like the next time you're doing a chore throughout the day, like I always like the idea of doing dishes, right? At some point when you're doing dishes, the next time, just check in with your body, see what is contracted, see how tight you're holding your glutes, right? We tend to hold so much tension and just squeeze that area unknowingly. So prevention for me looks like, what is your body doing, right? What are we doing? What can we improve? How do we stop this from happening? So where could the possible, fault lines be shown? Um, And so
Yeah,
there's definitely a lot of work that can be done there. Nothing's
that's
perfect,
awesome.
and prevention is, you know,
Yeah.
if it
The he
prevention was 100% accurate, nobody would be rupturing their Achilles, you know?
right. The healthcare system hates that word,
Yeah,
but,
I'm sorry it happens. Like
yeah.
there's no way to be 100% preventable.
That's
So
such an important thing to say. I say that to people all the time. Like, if I am never going to be the person who tells you, like, if you work with me, you're going to be 100% injury free for the rest of your life.
no,
And whoever does tell you that, like, that's a scam run in the other direction because
one
it's
the
just
other
not how things work.
you
But
gotta
there's
run
still lots that we can do in terms of prevention
for
as well. It
sure.
doesn't
And
mean,
we can make sure that the, silly stuff doesn't happen, but like injuries happen.
yeah.
It's and when we're putting our bodies through these things and we're running marathons or we're, playing football or any kind of sport or skiing or, just going about our day to day, like stuff happens. Stuff happens
Yeah.
and you can't, you can try as much as you want, but you can't prevent everything.
Yeah. Yeah. Awesome. So I just want to hear a little bit more about how it would work if someone were to, like, can they call you guys directly, book an appointment? Do you take insurance? Walk us
So
through that.
So you can call us directly. You can check out our website. We do a free 15-minute phone call with either myself or Dr. Adam. Our goal is to make sure that you are the appropriate candidate for coming in. We want to make sure that this is where you need to be, and we are the ones that can help you. With that said, we work with out of network benefits. We provide a super bill for our patients with the necessary codes and diagnoses on it. So if you have out of network benefits, they can be you can get paid back through your insurance that way.
Awesome. Do
Yeah.
people need a prescription to see
No,
you?
no,
Great.
no. So out of network, you don't need a
Love it.
prescription. Just
Love it.
come on in, come
Yeah,
on
come
in.
on in. And you guys, like, also treat women occasionally,
We
right?
do. We no, no, not occasionally. We
Oh,
have a
good.
therapist. So our goal is
Yeah.
men treating men, women treating women to whatever definition we want to call that by, right? We're not looking to
Yeah.
exclude anyone. It's you're in charge, whoever you feel comfortable seeing, we are happy to accommodate you. Um, we want everyone to be seen because everyone deserves to be comfortable in their own body. And with
Mm.
something like this, you see very quickly how uncomfortable people can get and how
Yeah.
much pain they can go through. And just how wrecked their lives can get. So we want to make sure that everyone is in a good place.
Love it. That's awesome.
Hmm.
And I will put, so just tell us quickly where the clinic's located, and then I'm
So
also gonna also, like, website and all of that stuff, and I'll put it in the show notes too.
sure. So our website is pelvis.nyc. We have a great domain. We are in Chelsea on 17th Street between 6th and 7th. So it's 110 West 17th. Beautiful neighborhood. We're directly across the street from a massive West Elm. So if you are looking for
Just
that,
a little light shopping.
just a little light shopping anytime you have sure. That's not dangerous for me at all. That's a great way to find us. Look for the massive West Elm down here, and we're directly across the street, and we're on street level. So, you'll see us as you're walking down 17th Street, and if you happen to be walking by, come on in. We welcome any walk-ins. We'll gladly show you around. We'll talk to you if you want to do a session and we have the time for it. Like, let's do it. Why not?
Amazing.
Yeah.
That's so awesome, Josh. Thank you so much for joining me today.
Thank you so much
And
for having me.
you and I are gonna have to get another round of drinks soon and
I
talk about
would
it
love
all.
it. That would be great.
Love it. Thanks, Josh.
Of course.